We have donned our pink today.
Yes, we do.
In recognition of Breast Cancer Awareness Month. And Kristen Aguirre is at the Blessing Cancer Center talking about what today? Kristen, good morning.
Hi, I am here at the Blessing Cancer Center, the Blessing Breast Cancer Center Awareness store. And they have a ton of stuff here for survivors, even if you just want to support the cause. With me now is Lucy. What do we have going on here?
Well, this is our annual Breast Center Awareness store. So we get together, we have t-shirts, we have sweatshirts, we have lots of fun pink apparel items. And like you said, it can go for survivors, it can go for family members, and all of the proceeds go back to our Breast Center's financial assistance program, which helps women who wouldn't be able to afford some of those screenings or maybe a biopsy, get in there and get that early detection going.
And how vital is it for women to kind of get those annual checkups?
It's extremely important. Our best way to fight breast cancer at this point without a cure is early detection. And if you do that yearly mammogram, if you do those regular self-exams, if you get your annual with your doctor, we can catch it early and we can get rid of it fast.
And so all the proceeds from here go to that program, right?
Exactly. They help those women who maybe need a little extra support, making sure that they get those early screenings regularly.
And you guys have something for everyone. We have t-shirts, hoodies, hats, scarves, pens. Is it important to kind of get this variety of stuff?
Definitely. We even have kid sizes of stuff. You know, everyone wants to be involved and wants to show support for the women in their lives that are so important. I think sometimes we can feel a little helpless when someone's diagnosed that you love. So this is a great way for us to give some of that love back to them.
All right, well, we are here celebrating Breast Cancer Awareness Month, and coming up later in the show, we are going to hear why breast health is so important for men and women.
All right, thanks, Kristen. And that was one thing she was talking about on Friday was men can get breast cancer too.
Right.
So I'm anxious to hear about that segment.
Yes.
Hey, you know what? Kristen Aguirre is at the Blessing Breast Center this morning.
Yes, she's learning all about Breast Cancer Awareness Month. We are all wearing pink. She is wearing pink as well this morning.
And you can too.
Yes, I am here, and we are celebrating Breast Cancer Awareness Month. And with me now is Lori Wilkie, who's a breast center manager. Why is getting these checkups so important for women?
Well, you know, statistics tell us that 1 in 8 women will develop breast cancer at some point in their lifetime. So we as women need to know what we need to do to protect ourselves. Every woman age 40 and older should have their first mammogram. That's vital. And they need to have it every year after that. Also, they need to start having clinical breast exams in their 20s. 30s, they can start talking to their physician and they'll do a breast exam. Also, women can also do self-breast exams. That means they do that check themselves monthly.
Where's the best way to do those breast exams? Is it in the shower? Is it laying down?
You know, whatever they're comfortable with. They really need to look in front of a mirror, and we need to look for breast changes overall. We need to feel for lumps. We need to look for redness. Itching of the nipple is something that we need to be very, very aware of, as well as dimpling of the skin, nipple discharge, clear or bloody in color. Those are all things that are imperative that we need to talk to our physician about.
And, you know, breast cancer is very geared towards women, but this is something that men suffer from as well.
Also, 1% of men can get breast cancer as well. So they also need to follow all of those same things that the women do as well. You know, they need to look at their breast, they need to look for lumps, redness, swelling, any of those things. They would need to come in and actually get a mammogram, and breast ultrasound is something that we do for them also.
Great. Thanks, Lori. So coming up later in the show, we're going to continue showing you guys why breast health is so important for men and women, and we're going to continue looking at all the fun stuff that the store has here.
All right, so we will look forward to your future reports about Breast Cancer Awareness Month. And that's where we find Kristen Aguirre.
Yes, how's it going, Kristen?
Yes, I am having a great time here at the Blessing Hospital's Breast Cancer Center Awareness Store. With me now is Lori Wilkie, who is the breast center manager. Can you tell me a little bit about the store? Where do all the proceeds go to?
The proceeds all 100% goes back to our foundation, which pays for imaging biopsies for women that are in need. Those that may just be having a hard time right now, normally they have no problems paying their bills, but for whatever reason they've had a hardship in their life, we're able to then step in and help them pay for a mammogram, even all the way up to a biopsy, which can cost upwards of $10,000.
And so this morning we've been talking and stressing the importance of getting screenings, and this way we're helping women to kind of really put those get those done. What are some risk factors that men and women should be looking for?
Well, as a woman, that is our number one risk factor for breast cancer. Just being female. That's it. As we get older, our chance of developing breast cancer increases. So even when we're young, we still need to watch out for breast cancer. It can actually even be a little bit more aggressive as we're younger. But absolutely, as we get older, we need to screen definitely every single year. Get your mammogram every single year. A couple other things. If a woman has already had breast cancer, she's at a higher risk, which we know that her physician will be following her more often and getting those regular checks. Also, if a woman has a family history of breast cancer, then she also needs to be checked regularly.
All right, perfect. Thanks, Lori. Coming up later in the show, we are going to continue to bring you things that you need to be looking for, risk factors, and why screening is so important. So make sure you stay tuned for that.
Indeed, we will. Stay tuned now from Blessing Hospital's Breast Cancer Awareness Store.
Yes, she's talking about breast cancer awareness. We're all wearing pink this morning. How's it going, Kristen?
I am here learning all about breast cancer awareness. With me now is Lori, the breast center manager. You guys have a new program, right?
We do. We're so excited to bring to the women in our community a breast navigator program. And what that is, women that are newly diagnosed, we introduce them to Sheila, who is our navigator. And at the time of biopsy, she talks to them and talks to them about if their diagnosis comes back as cancer, she's here to help them.
So, Sheila, you're really that crutch for women. And what does it feel like to kind of be there through the whole process?
I feel like I'm like their wind beneath their wings. I'm there to support them, to help them get through this, to accompany them to their physician's appointment. When they get the new diagnosis, find out what the plan of care is going to be, educate them. I also try to find out, assess what their situation is at home. Are they going to have any kind of barriers to getting their treatment? So I help them work through that. You build a bond with them. You get to know them. You help them. I just really find it very good for them.
And why was it so important for Blessing to kind of initiate this program, to have that clutch for women that are going through this?
Women actually were coming to us and saying that I can't do this. I can't get through this breast cancer diagnosis. I know the physicians are good. It's not that. I just need someone to help me get through the process. Some of them had loving support even at home. It's just so much that you hear at one time, and it's so overwhelming. And to have someone like Sheila there who has the knowledge and can actually just understand what the physician is saying, and if nothing else, then document what the doctor is saying and be able to give those notes back to the patient at the time that they leave that appointment. We're finding that women are just finding that such a great thing for them.
Great. Thanks, Lori. Well, we've been talking about screenings and what you need to know to stay preventative of cancer. So make sure you come back later in the show. We're going to keep talking about it. And if you have any questions for Lori, make sure to ask on our Facebook page or even tweet me at Kristen Aguirre.
All right. Thanks, Kristen.
What made it
learning
big?
all about it, Kristen?
Yes, I am. And we're learning all about how this new store can really benefit women. How many people has this store helped out?
Actually, to date, we've been able to help over 237 people. They're enrolled in our program where we actually pay for their imaging, whether that be mammography, biopsies. We also pay for the physician's bill also, which is something that women find so beneficial to them. I mean, we sometimes all can go through those times in our lives where we just need help, and that's what we're here for.
And that was kind of really the inspiration for you guys to get the store, was to help out women, and then also because people were actually wondering how they can support breast cancer.
That's right. We were getting calls from people saying, do you have any pink items that I can buy? Do you have anything? I want to support my mom. I want to give my mom, a t-shirt, a pink t-shirt in honor of breast cancer awareness. So it was a perfect combination where we have the product for them to buy, but then 100% of the proceeds goes into our foundation fund, which then in turn can help people. And to date, we've been able to help over, the 237 people, but also pay out over $200,000 to women in our community, and it all stays local. It's our neighbors.
So for people just tuning in now, what is something that you would tell them is the most vital thing that they need to do to kind of be aware of breast cancer?
What they need to do is they need to have their mammograms done annually. Beginning at age 40, they need to have their mammograms done every single year. The other thing is they need to visit their physician, and they need to do a clinical breast exam. And then lastly, just do a breast exam on themselves monthly.
All right, perfect. So the best way to kind of be preventative of breast cancer is to constantly screen and get your mammograms as soon as you turn 40.
All right. Thank you so much for the very important information this morning, Kristen.